Once a diagnosis of high anion gap metabolic acidosis is reached, the next step involves identifying the underlying cause. The mnemonic mud piles is commonly used to remember the causes. Laboratory tests include serum lactate to evaluate for lactic acidosis, serum ketones to assess for ketoacidosis, particularly in diabetic or alcoholic patients, renal function tests, blood urea nitrogen and creatinine levels to assess for renal failure, toxicology screening to screen for substances like methanol, ethylene glycol, and salicylates. The gold mark mnemonic is favored because it incorporates newer and more specific causes such as rhabdomyolysis, oxaproline, and D-lactate, which are not included in mud piles. It is important also to calculate the osmolar gap in cases of unexplained high anion gap metabolic acidosis to identify the presence of toxic alcohols. We will talk about this in another video. Now we need to calculate the delta-delta ratio to identify any concurrent metabolic alkalosis or normal anion gap metabolic acidosis. So what is the delta-delta ratio? The delta-delta ratio is a diagnostic tool used in the context of high anion gap metabolic acidosis to identify potential mixed acid-base disorders. This ratio compares the change in the anion gap to the change in bicarbonate concentration. As extra acids in the blood, such as lactic acid or ketoacids, increase, bicarbonate decreases as it buffers or neutralizes these acids. In an uncomplicated high anion gap metabolic acidosis, the increase in the anion gap should correspond to a decrease in bicarbonate in a 1-to-1 ratio. Deviations from this expected ratio can indicate the presence of additional acid-base disturbances. A delta-delta ratio of 1-to-1 suggests a simple high anion gap metabolic acidosis. A ratio greater than 1-to-1 indicates a concurrent metabolic alkalosis as the decrease in bicarbonate is less than expected for the increase in the anion gap. A ratio less than 1-to-1 suggests a concurrent normal anion gap metabolic acidosis as the decrease in bicarbonate is greater than expected for the increase in the anion gap.